Severe sepsis is one of the common diagnoses in any ICU all across the world, and it is responsible for very high morbidity and mortality, and more so in our country like Asia Pacific region. The mortality of severe sepsis is very high. So before we go ahead, I think right at the beginning I'll ask Dr. Professor J.V. Divatia, who is the head of the Department of Anesthesia and Critical Care at Tata Memorial Hospital, Mumbai. You have been the principal investigator of one of the major study done on sepsis in Indian ICUs, the INDICAP study. So what were the key findings of this study?
So the INDICAP study stands for the Indian Intensive Care Case Mix and Practice Pattern Study. And it was an attempt that we made in 2010 and 11 to sort of see what all was happening in our ICUs in India, what sort of patients were there, what was the mortality, how severe was the illness, what practices were being made. So it was a 4-day point prevalence study. So we looked at all patients on the ICU on 4 days spread out across 1 year. We had 4,038 adult patients from 120 ICUs in India. First, I'll tell you about the overall part and then a little bit about the sepsis part of the study. So overall, the mean Apache score was about 17. 46% of patients in ICUs had at least one organ failure. The 30-day mortality, which is a mortality from 30 days of the study day, was 18%. And this included patients who died in the ICU as well as those who were terminally discharged from the ICU, many of whom would fit in with a sort of LAMA category. 37% of patients were ventilated, 22% required vasoactive drugs, so it's a moderately sick sort of population. Out of these 4,000 odd patients, 28% had severe sepsis or septic shock at some point during the ICU stay. The mortality in patients with severe sepsis or septic shock was 34%. An alarming finding, or a finding which we need to take note of to improve our systems, is that patients admitted in public hospitals, self-paying patients, and patients in inadequately equipped ICUs, they were independent predictors of mortality. Okay. So when you go to sepsis, we also see that the mortality, like I said, was 36%. But if you look at tropical infections, that was malaria, dengue, leptospirosis, and scrub typhus, these constitute about 20% of patients with severe sepsis and septic shock in the ICUs. The mortality in these patients was much lower. It was just 21%, and these patients were much younger than patients with other types of sepsis. So that's a sort of broad summary of the findings of the INDICAP study, which is actually now being readied for publication.